to TV Kojiko. Our program today is Municipal Matters, and joining me today will be Bill Patchett, Colin Sanders, and Bill Johnson representing Keystone House. But up first is freshly retired CEO and President of Northumberland Hills Hospital, Joan Ross. Joan, nice to see you.
Nice to see you.
I'm glad you could drag yourself away from your first little bit of retirement to come on onto the show. For those of you that aren't aware, Joan retired on the 14th of November, and the new CEO and President is Robert Bilton, and he started on November 10th, so hopefully we'll get him on the show sometime in the not-so-distant future. So the first thing I have to ask you is, how's your sleep pattern been since you retired?
Well, of course, I'm much more relaxed. I don't have a lot of things on my mind these days.
There you go. Keeping it easy, and I mean, it's only been a few days, so obviously you're still trying to put together, well, I guess you're still trying to get your mind wrapped around the fact that you don't have to deal with that every single day. Obviously, I mean, Northumberland Hills Health Center, it's huge, huge endeavor. Obviously, always fundraising. I see it every time I turn around, there's always more fundraising on, and you've done a great job doing that. You were with the Northumberland Health Center for 12 years, is that correct?
Yes, yes.
Now, how have the changes been in the 12 years? I mean, when you first came on board, obviously it was the two hospitals under the one umbrella at that point?
Yes, and in fact, I actually had experience with the hospital before that because I was the ministry consultant that was responsible for amalgamating the two smaller hospitals. So I saw two small hospitals that came together to form one much larger hospitals with many more services provided locally. Much, much needed in this community.
Now, is it a lot easier to maintain just the one facility as opposed to the two smaller facilities?
Well, yes and no. A larger facility is certainly a lot more complex, so it requires a broader diversity of skills, but certainly the travel time is reduced. You're not traveling between sites all the time and trying to maintain communications.
Now, what was your biggest challenge over the 12 years? Like, would it have been the amalgamation, or were there other challenges much more significant than that?
There have been many challenges. I would say the biggest challenge has been merging the cultures and getting a culture that really promotes excellence.
And that's, of course, that's bringing on the right staffing, that's the right caregivers, making sure that the proper funding was there from the province. How has that been, getting the funding from the province?
A lot of struggles over the years, but I believe that we have adequate funding for the current programs and services. We certainly have approached the LHIN about some of our challenges. They're called factors beyond the hospital's control, like the ALC patients, the patients that are waiting for nursing homes, but there aren't any, so they occupy our acute care beds.
Ah, well, that's a bit of a problem too, obviously, because now you can't free up those beds to bring in other acute care patients at the same time.
Exactly, and in fact, we haven't been able to close the beds that we had planned on for budget purposes.
Well, you said there were three topics, three issues. One was the amalgamation, of course. Let's talk about some other issues that have been troublesome, if you will, or that were obviously overcome by you, but some difficulties there.
Well, as I said, there have been many challenges. Building the new hospital required the work of a whole team of people, fundraisers, etc., and the staff were magnificent through that. They really made it all come together and happen very quickly.
Well, there's one thing I've noticed about you when you're interviewed is you always talk about the staff and you always talk about the team. So that must have been a lot of fun for them to have somebody working on their behalf as well as someone who's in charge.
They're my pride and joy.
How do you manage to do that? How do you manage to wear those different hats when you're dealing with staffing like that?
I like people, that helps. I enjoy seeing people grow and develop. I think it's absolutely critical in this environment that you take care of the staff that work for you, that produce the quality results that you want, and ensure that they have both the skills and knowledge that they need. So continuing education, continuing learning is of utmost importance.
Well, that's something that we talk about. I talked to a fellow recently who was at medical school for some time, and he said, like, one of the hardest things to deal with in medicine is the fact that most of these people just aren't people persons. A lot of doctors have, I don't want to say a God complex, but they have a different approach to life, and they do tend to put themselves above other people. So, I mean, that's obviously a little bit difficult, and that's something you have to deal with as an administrator too. So how has that been?
We have a great group of physicians. Obviously, you always have some physicians who are more skilled than others in their interpersonal relationships, but I'd say by and large, we have a good group of physicians who really, really care about people. And in a small community, they tend to get involved in the community, so they get to know everyone.
Well, that's it. And that's really where the people skills come into play, isn't it? Now, you're also on the recruiting team as well, trying to bring other doctors, or you were rather. Are you still going to be staying with the recruitment operation to try and bring doctors to the community?
No plans at present, but I'm pleased to say that I believe our emergency will be fully staffed now. We have been very successful lately in recruiting emerge physicians, and we are also hoping to get another specialist in internal medicine on board. So we're not in bad shape.
Well, no, and I'll tell you, I've been to the emerge a few times. I was there recently, actually, and it was 2 hours. I was in and out. So, I mean, for some hospitals in the province, that's just unheard of. I know in Scarborough, for instance, I've spent sometimes 8-9 hours in emerge waiting, and the fast track program that was implemented at the hospital really helps to move people through as well. Was that something that you came up with, or was that provincially mandated, the fast track?
It wasn't provincially mandated, but I guess I can't claim it's my idea. It certainly was a group of the clinical people that work in the hospital that suggested it.
Now, was that a result of the low number of general practitioners in the area and the need that was created, especially now with the walk-in clinic here in Cobourg being closed?
Yes, it certainly was needed to take care, particularly of those patients who don't have a family doctor. It's one way they can access primary care.
Well, that's definitely something that everybody needs, obviously. What do you figure? What do you think? I mean, it's been 12 years with Northumberland Hills Health, and you were with the Ministry of Health before that.
For 3 years. Yes.
Is your background in medicine?
No, I started off as a registered professional dietitian, so my interest has really been in preventative health.
And that's really where the money needs to be spent provincially, isn't it?
Exactly, exactly. We need to eat right, exercise regularly, and take care of ourselves.
Well, and that's something that you promoted at the hospital as well. I noticed that there's posters all over the hospital talking about prevention and making sure that people take care of themselves so that they don't find themselves in emergency medical situations. Has that been a pet project for yourself then?
It certainly has been a special interest of mine. I know it seems a bit odd that somebody who works in an acute care setting is trying to keep people out of hospital, but that really is our goal. Well,
if you can keep them out, that means you can free up the beds.
That's right.
Keep the beds free. So now what do you think were the greatest, or the most satisfaction that was brought to you then from your own perspective in the 12 years that you were with Northumberland Hills?
Well, certainly the building of the new hospital has to be right up there as something I'm extremely proud of, and proud of the way people all rallied around it. And by people, I mean people in the community, the staff, the physicians, the foundation, the auxiliary, everyone worked together to make that happy. And of course, as I said previously, the people. That is my greatest sense of satisfaction, building this great team that I know will be just as helpful to Robert Byron when he comes as well.
Well, I know that one of the biggest stumbling blocks you had with the new facility was convincing the provincial government that it was, I mean, the community raised, from what I understand, $25 million by themselves, went to the province and said, okay, we've raised this. And the province just about, I mean, they were apparently days away from saying no go, no go. Apparently, Doug Galt went to the Premier and said, look, it's either going to happen or I have to resign. So, I mean, did you feel that kind of pressure when you were dealing with the province, as though they weren't as willing as they should have been?
Well, having worked in the government, I knew the process. It isn't easy. You have to keep arguing, keep making your points. The funding doesn't come automatically. It takes a lot of meetings and a lot of background work. It helped knowing the people that I was dealing with, certainly.
So that was a key in for you then, people at the ministry who were there to go to bat for you?
Well, and to know who to talk to, who to approach each time. So.
Now, have you passed those names on to your successor?
I certainly can, and yes, I certainly will.
Well, let's talk about your successor. Do you know much about Robert Bilton and what his background might be?
Robert Byron.
Is it Byron? Oh,
Byron,
I've
yes.
got Bilton here, sorry.
He came from Guelph General Hospital. His background is as a CA, a chartered accountant, although he has a master's in health administration. He has a very diverse portfolio, so a lot of experience in different parts of the hospital. I think he'll be a great asset. He's very pleasant, a very calming influence, I think, too.